Hello everybody and welcome to another Facebook Live, YouTube Live video of the current situation with the COVID-19 vaccine and the current situation with the COVID-19 virus itself. I'm Jon Meyer here in our WNEP digital studio. We have a lot to break down for you today. I hope you find this helpful. I say it every time when I look at all this data, I think it's helpful. So I hope it's the same for you too. So let's take a look at the current situation. We're going to start with the vaccine because we've heard a lot about the vaccine this week. So let's look at what's going on. First of all, the big stories this week. We heard about the mistake, and that is that the state gives out the vaccine to these providers across the state. So the pharmacies, the grocery stores, the hospitals, and things like that. Some of those providers, we found out from the Department of Health this week, were giving doses that were meant for the first dose. They were giving doses that were meant for the second dose as the first dose. It's the same medicine, so there was no health problem, but what the Department of Health said is those were viruses that were meant for people to get that second dose, 200,000 of them, and all of a sudden they weren't there. So they had to scramble and delay appointments to make up for that, and use some of the doses that were meant for first doses for second doses. I know it sounds complicated. That was the explanation we got from the state. Then the weather, the storms and the winter weather out in the Midwest and the South, that's impacted getting the shipments here. So the Moderna vaccine especially has been impacted by all of this. We're hearing from a lot of people that are having their vaccinations delayed because of the weather and because of this mistake that caused the scramble in vaccinations. Here's the situation, though, that we have in the state right now. These are the latest numbers from the Department of Health. So I'm going to kind of explain how the state's been doing it and hope this helps you understand where things are now. I'm going to point out a little bit of a confusion that I have been trying to get rectified from the Department of Health and haven't been able to really get it cleared up. But so far, the federal government, the state says, has given Pennsylvania 2.7 million doses. 1.6 of them Pennsylvania has allocated for the first dose. And of those, 1.3 million shots have gone into people's arms for the first dose. 1.15 million have been allocated for the second dose. And of that, 479,000 doses have been put in people's arms. Here's the big question that I've been asking. We keep hearing from the state that they have been saving this amount for the second dose. So if they've been saving it, what I don't understand is if you've only given out less than half of that, shouldn't there be vaccine available to make up for this 200,000 vaccination mistake? They said that some of what's allotted hasn't been shipped yet, but we're still trying to get that clarified a little bit more. But anyways, this is the situation right now. So just to break it down a little bit more for you, so this is the total amounts of shots that have been given. In total, into people's arms, 1.86 million. First doses of that, 1.38 million. Of those people that got the first dose, 479,000 have also had the second dose. We're approaching 500,000 Pennsylvanians that have received the second dose and are fully vaccinated. So that's the breakdown of Pennsylvania. This represents around the 10% range of Pennsylvanians that have had at least the first shot of the vaccine. So comparing week to week, there's definitely a noticeable difference this week compared to last week. Last week, the 5th through the 12th, Friday to Friday, we're looking at 358,000 shots were given out in Pennsylvania. This past week, 343,000 shots. So we are seeing an impact from some of this in the amount of vaccinations that are given out. That is down 15,000 from the week before. And most of this issue, what the state is telling us, is going to impact the coming week. So we're likely to see that number go down even more. Of course, we'll keep track of that as the week goes on. When vaccines were starting in Pennsylvania, healthcare workers were the ones that were getting it. And we were seeing young people getting the majority of the vaccinations. Well, then we all know in January it switched that those over 65 and those with high risk were allowed to get the vaccine. That has dramatically changed who's getting vaccinated. It is by far the elderly in Pennsylvania right now that are getting the most of the vaccines. In fact, those 60 to 74 now make up 32% of all the vaccinations so far. 75 and up make up 25%. So more than half have gone to people that are older than 60. And then you see the breakdown here of the other age groups, 15 to 29, 30 to 44, 45 to 59. So really the elderly are making up a big chunk of who's getting the vaccine now. And we know There are a lot of you that are out there that are trying to get a vaccine for yourself or trying to get a vaccine for your mom, your dad, your grandma, your grandpa, and you can't find an appointment. You're struggling to find all this, and the weather and now this mistake that's led to this scramble to come up with vaccines, that has led to more frustrations. There's going to be more, especially first dose appointments that are going to be pushed back a little bit. So you're going to have to deal with it even more. And we keep asking the state what's going on with this. In fact, the Department of Health said they've even hired a consultant now to help them better with the rollout of this vaccination. But the issue now is that if you've had the first dose, you have to get the second dose. Moderna was supposed to be 4 weeks, but the CDC says it can go to 6 weeks. But in that time frame, you have to get that second dose. So that's why the state's scrambling to make sure everyone gets the second dose that they need in that time frame. So let's look at the percent of the population vaccinated. This is the percent of people living in each county that has had at least a certain percent of the vaccine, at least the first shot of the vaccine. So in the greenish yellow counties you see here, 13% of the population and up have had at least one dose of the vaccine. The blue counties, it's 9 to 11% have had the vaccine. 3 counties in our area are lagging a bit behind, 8% and less. Monroe, Pike, and Tioga counties have the lower amount of the population getting vaccinated. Montour County here, where Geisinger Medical Center is, a lot of healthcare workers are, 36% of the population there has had at least one dose of the vaccine. 15% of Montour County's population is fully vaccinated now. That's with the hospital there. So there you see the counties that are vaccinating the most of the population as of right now. Now we're going to move on to, that was the vaccine. Now we're going to move on to the virus itself and take a look at the trends in that. And this, while there's some issues with the vaccine, the virus itself and its spread in Pennsylvania, there are a lot of promising signs with that. So let's go through some of that, because this is some of the data that we've been waiting to see, and we've been seeing it trend this way for a while, and we're really seeing it this week. New cases from this week compared to last, 5,461 fewer. That's a big difference this week. Incidence rate is the number of people with the virus per 100,000 people over the past week, and that's down 158 to 116. That's a big drop. Positivity rate down from 8% to 6.5%. The health experts keep telling us that 5% positivity rate is key. That's the level of concern, and Pennsylvania is getting pretty close to that, where we'd be back in that realm. We haven't been there since the fall, so that'd be a big update there. Positivity rate, by the way, is the percent of people getting a test during the week that have a positive result. And hospitalizations, 508 fewer patients. We'll show you in a second. Hospitalizations are coming down significantly too. So here is the tracking the 14-day average and the new cases here in Pennsylvania. And you can see that it's easy to see when you look at the graph where we peaked before Christmas and how we have been significantly declining almost at the same rate as what we rose in the fall. And what I'm starting to notice from this is it's almost like we're walking down some steps for each week. If you look behind the dotted line, you see the little lines are the new cases per day. And each week, it's been a lower step that we've been going down. And here you see this week is definitely a lower step. We're averaging, most days have been below 3,000 new cases a day. And just to give perspective, so you see here, let's go back. We're around 3,000. We're trending now. The state was up above 10,000 per day at the peak. So a huge decline in the amount of new cases that we're adding here in Pennsylvania. And I want to point out, you don't see it often on the national news, but this is playing out nationwide too. There is a steep decline in new cases that's happening as more people get vaccinated, and whatever other factors are going into this, the decline is underway with COVID right now. And of course, that's what we all want to be seeing, and we're hoping that trend continues to see it keep going down. Here's the new cases across our viewing area today. I want to point out, every day we look at this map, it's getting noticeable that they're a lot lower in most of these counties than they were just a few weeks ago. Lackawanna has the most today outside the Lehigh Valley, which isn't technically in our viewing area. We include it because we're on in parts of that area, but 80 in Lackawanna County, Luzerne 69, 50 out in Center, 41 in Lycoming, 36 in Montour. But I also want to point out, I mean, we're starting to see more and more single digits, like 4 in Susquehanna, Sullivan has 0, 2 in Union, 7 in Montour, only 16 in Schuylkill. They were adding more than 100 most days just about 6 weeks ago. So big changes we're seeing on that. And here's the positivity rate. And I was saying this is the percent of people that go get a test. So last week, a certain amount of people went and got a test. And of those people that got the test, this is the percent that had got a positive result back. This is a way that health experts use to track the community spread, as they call it, how much the virus is spreading in the community. Because if they're testing a certain amount and that a big percent is getting that, they know that there's a lot of virus out there. And now we're seeing that come down. Pike and Wayne are at the most at 10, but this is the first time in months we have had all the counties in our viewing area at 10% or below. And we've said the level of concern we keep hearing is 5% or above. So a lot of the counties are still above that, but getting very close to that 5% number. Pike at 10.5%, Wayne at 10, and you can see quite a few counties in the 9% range. Clinton, Bradford, Susquehanna, Luzerne getting down into 8-7% range. Lackawanna's at 5.4%. Some of our counties are at 3%, 4%, below that 5% threshold. So I'm kind of showing this of the counties with the highest numbers, but pointing out to you that quite a few counties now are at that 5% number that we were way above for months. With some of these counties here, we're up at 20-some%, the positivity rate. So this is a huge sign as I look at the numbers that we're watching, because percent is one thing that they pay attention to closely when they're tracking COVID-19. So hospitalizations, that's how you know how sick people are getting with COVID. And we can see that same thing. We had a peak. I knew that would happen if I touched it. We had the peak right before Christmas. It started going down right after the holidays, and we've been going down just a couple little bumps here and there. But now we're almost, I would say by Monday, there'll be fewer than 2,000 patients in hospitals across Pennsylvania with COVID. And we were told, back in December, how important it was to make sure those hospitals didn't get overwhelmed. Well, they didn't. They were strained. If you talk to friends that are healthcare workers, it was a rough couple months, but big differences now compared to what we saw back then in hospitalizations, way less people in the hospital. And I always want to point out to you, remember, most people that get COVID do not have to go to the hospital. They don't get that sick. Some people get really sick and can treat it at home. And of course, there's that small percent that gets sick enough to go to the hospital. And those were these numbers that we were seeing back in December. But a big change on that. We're almost getting back to the level we were in the fall, which is good to see. And here I just wanted to put up the hospitalization. So these are the current patients with COVID in hospitals across our viewing area right now. The biggest thing here is they're all below 50 in each of the county. Montour, where Geisinger Medical Center is, it was up near 200 6 weeks ago. Now it's at 42. These are showing the change since earlier this week. So Montour is down to 49, 47, it's down to patients in Luzerne County, Lackawanna at 39, Schuylkill 31, Bradford 23, up a little, but Bradford's half of what it was 6 weeks ago. And you see not many people hospitalized in some of these other counties. So that is a big change. And of course, when you look at this overall, you're going to see lots of big numbers that are thrown out there. The most important numbers to pay attention to are the people getting the sickest and having to go to the hospital, and of course, those who are passing away. And when we see both of those following the way they are, after tracking this through our peak recently, this is definitely promising signs to see. Of course, those 49 people in Montour County and Geisinger Medical Center, they're not feeling so good right now. And we feel for those people that are still suffering from it right now. But all of us want to see these numbers come down. We're getting to see that now, and we're going to hope that continues. The deaths in Pennsylvania, there was our spike back in the spring. We had a peak higher than that in December, but that has been coming down significantly since we had that peak back then. We were seeing anywhere from 200 to almost 250 people a day die back then. Now it's down more in the range of 50 a day, which is of course still a relatively high number. But you can see that there are promising signs when it comes to deaths too. COVID-19 death statistics tend to lag behind hospitalizations and new cases by a few weeks, and that just makes sense because it takes time for the person to test positive, to get sick enough to go to the hospital, and then sadly get to the point where they pass away. And I always point out COVID deaths in Pennsylvania, this is people dying with COVID, because there are quite a few people that are passing away that have other comorbidities, is what they say, other ailments and things like that, and coronavirus is one of them. Of course, coronavirus is causing many of those deaths, but it's important to just note that these are deaths with COVID here in Pennsylvania. Luzerne, let's go through county by county now and just take a look at how some of the counties are trending. Luzerne County is our most populated county by far. It had its peak back before Christmas, a little bump after New Year's, and it has been declining ever since. A big thing about Luzerne County, almost every day from, back in the end of October until a couple weeks ago, Luzerne was adding more than 100 cases a day. Now, it hasn't had more than 100 cases a day in almost 2 weeks. Big changes for Luzerne County. In a county that is that big, these are promising signs for Luzerne. Lackawanna County, a big rise that happened there until around Christmas. It had a steep decline. One thing I want to point out about Lackawanna County, that decline has leveled off a little bit. Still trending at a higher level than when it was like over the summer and into the fall. But we'll keep an eye on Lackawanna County. It is slowing down its decline. That doesn't mean it's rising in its growth, but that's one thing to note there. Schuylkill County was one that saw a rise from September all the way through the holidays. It continues to go down. It's back into the level almost where it was in September, so a big change there. Like coming counties like Lackawanna, it had a spike up near around 150 cases a day, and now it's trending, it's leveled off some to trending just below 50 cases a day. So it's a third of what it was seeing at the peak, but it is leveling off a little bit, not declining in cases as much as we saw before. Northumberland County, same thing, leveling off a little bit. I want to point out about Northumberland County, there's an outbreak at SCI Cole Township, the state prison there, 160 inmates. I think I saw 30 staff members with active cases right now. That has added to Northumberland County's numbers just within the past week or so. And Bradford County, same thing. It saw a long rise. It was at a high level for its size, a smaller county for a while, but it has been trending down and even taking a greater dip now because it's had some single-digit cases just in the past few weeks. So that's the update. That was the situation with COVID, the situation with the vaccine. We know there's a lot of frustrations with the vaccine itself. Because everyone wants, their parents or the elderly, everyone wants to get this vaccine. Well, not everyone. Of course, there's people out there that don't necessarily want it. But those that do want it have been struggling trying to find a vaccine. But we do point out that as of right now, 1.3 million Pennsylvanians have had at least one dose of the vaccine. We're getting close to 500,000 Pennsylvanians who are fully vaccinated. So the vaccine process is working. And I said this the last Facebook Live I did and on YouTube Live, that if you had said a year ago that we'd be getting vaccinated for COVID-19 in February of this year, it'd be pretty surprising, because a year ago right now, most of us were paying no attention to it. We were hearing about it in Washington State and a few other places in China, but we were not thinking about it here. So in March of last year, it blew up, and here we are in February of this year, 11 months later, and 1.3 Pennsylvanians have already had the vaccine. So there has been a lot of progress with the vaccine, but it's understandable the frustrations when you see the different issues that have been having and trying to get the vaccine. So that's understandable too. And then this week, there's the mistake that led to 200,000 doses being put in the wrong first doses instead of second doses, leading to a scramble. Obviously, there's frustrations out there. But most importantly, I just go back to some of these stats. Let's keep our eyes on the ball, so to speak, that all of it, tracking COVID-19, is going down. So I hope you not enjoyed, I don't think that's quite the word for this. I hope you found this valuable. I'm going to try to keep doing at least one of these a week because, like I said, I go through all this data, make up all these graphs and all this kind of stuff, and I kind of do a lot of it for myself so that when I'm on TV, I'm able to explain with more of an understanding. I'm no medical expert. If I have questions, I get in touch with those that know more, but I'm passing along to you what I'm able to find out, and I hope you find it helpful too. So stay safe, everybody. Stay healthy, stay tuned, and we'll be back with more for you later. I'll see you on the news tonight, everybody. Have a great day and have a great weekend. Bye now.